Hello, I'm the nurse for Eric Ford, who is a 28-year-old African-American male, full code, who was brought to the ED by his mother for auditory hallucinations and paranoia. The patient was diagnosed with paranoid schizophrenia at the age of 23. The patient also has a history of a suicide attempt, but denies current suicidal intent. When asked about that suicide attempt, he was just feeling overwhelmed with the voices and just wanted to do it. And when he woke up in the hospital, he stated that he was very upset. When asked about the voices, he states that they were sometimes random, like telling him jokes, but lately they have been gotten worse, such as telling him to commit suicide or that the end is near. Patient states that the voices get worse for no reason sometimes, but they get especially worse when he's alone in a dark room. Patient was taken risperidone but ran out due to the inability to pay for the medication. Patient states that the medication was controlling the voices, but without it, they have become significantly worse. Patient states that listening to music, as well as being with loved ones, helps him ignore the voices. The patient, upon assessment, appeared calm, but guarded and paranoid. He does not initiate conversations. He appears to be eliminated with his ADLs and presents with disheveled clothing. He would avoid eye contact with me, and his posture is rigid. Mr. Ford also is suspicious and guarded, with a flat affect. He only responds to questions. He does not have a problem with his articulation or speech rate. His volume is normal. He is experiencing paranoid thoughts and does not always give relevant information. He sometimes exhibits clang association and rhyming, but he denies homicidal intent or ideation and intent to act on those suicidal commands of his hallucinations. Mr. Ford expresses constant auditory hallucinations as well as paranoid delusions of persecution. He told me that he feels like he is being followed or watched by an unknown group of people, and he was worried that they were gonna get him in the hospital, to which I told him that he was safe in the hospital. He is alert and oriented ×4. He appears to know of his diagnosis, but does not understand the full extent of his diagnosis. The patient has no known allergies. Upon arrival to the ED, his blood pressure and heart rate were elevated, but recently his current vitals are the blood pressure of 120/80 and a heart rate of 88. As previously stated, he was taking risperidone 2 milligrams by mouth BID until he ran out of his prescription. And the patient states that he also took trazodone 25 milligrams by mouth every night due to insomnia to help him fall asleep with those voices. He is displaying the desire to seek help. I believe the patient is at a risk for a negative quality of life due to his trouble coping with the symptoms of schizophrenia. His mother appears to be very worried for his safety when spoken to on the phone. She also admitted that he has been experiencing poor appetite. So I believe some interventions that will be helpful for Mr. Ford's case is working with case management to assist with medication access and cost. I also believe that it is important to help educate the patient of utilizing and identifying coping skills, such as that quality time or music that he stated earlier. I also believe it is important to educate him on ongoing care, such self-care, and that he should seek help if his suicidal thoughts become urgent. I recommend frequent check-ins with the patient, making sure the patient knows he is safe, and maybe possibly prescribing alprazolam for anxiety.